hospital will happen in India.
I just want people around me to be as happy as I am. So the whole effort is to spread the happiness around.
Thank you so much. I'm extremely grateful to Arnab and the Republic TV for giving me the opportunity. I have certain predictions about the future of my country. I believe India will become the first country in the world to dissociate healthcare from affluence, from wealth. And I believe, I'm sure, now you must be thinking, oh, we heard this before. It's going to take 50 years or 70 years to happen. It is going to take less than 5 to 7 years. I am optimistic because of the changes what is happening in our country. My suggestion or prediction what will happen is that the policymakers will change their thinking that the healthcare has to be given to people free of cost with the taxpayers' money. This has been the thinking across the world of all the developing countries. But we studied the countries which have successfully offered healthcare for free to the citizens with the taxpayers' money. There are three things common with these countries. First thing, all these countries are very small countries with a population of 500,000, 1 million, 2 million. There is no single country, large country in the world, even as big as United States and as rich as United States, is able to offer tax-free healthcare to the citizens free of cost with the taxpayers' money. So that is the first difference. Second difference, every country which is offering free healthcare has a very high tax to GDP ratio of 25% to 45%. Our country has a tax to GDP ratio of 11%, 11.5%. It's simply not possible. And the third reason why India can't dream of free healthcare is because these countries are already spending more than 10% of the GDP on healthcare. And we are hardly spending 1.5% of the GDP. We need to look at some other option. And the other option is universal health insurance to everyone at a price what people can afford. Now, you must be thinking, if health insurance is the way forward, why this transformation has not happened? This hasn't happened because of the trust deficit. People do not trust health insurance for three reasons. First, in the delivery of healthcare in India, there are three important stakeholders. First is the hospital, second stakeholder is the health insurance company, and the third important stakeholder is the patient. Hospitals do not trust the health insurance company. Health insurance company doesn't trust the hospitals. And the patient doesn't trust both parties. And these two parties don't trust the patient. So we have a situation wherein the three important stakeholders of delivering healthcare do not trust each other, and that business cannot be scaled up. But it is going to change when the hospital become health insurance provider. Today, about 16 to 18% of the heart surgeries in the country is performed by us. More people develop heart attack, it is better for my business. I have absolutely no incentive to prevent people from developing heart attack. But situation will change when I become a health insurance company. Today, when I tell a patient that you need a bypass grafting, first thing what goes to the patient's mind is it really required or he wants to make some money out of me? Whereas when I become a health insurance company and tell the patient you need a bypass, he will happily agree because I'm going to pay for it. Now, is the hospital going to become a health insurance company? Yes. Thanks to IRDA, which is the Insurance Regulatory Authority, it took us just 4 months to get the permission from IRDA, which would normally take more than 2 years to become a health insurance company. And all this transformation has empowered hospitals like us to become a health insurance company at a pace what is unbelievable. And this is new India, and this is what is happening. Next 100 million families work for the first 100 million family directly or indirectly. If they can nudge the second 100 million families to buy the health insurance, because I would like my driver, my cook or the gardener, everyone to buy the health insurance, because if they don't have the insurance, when they fall sick, I have to pay for it. I can't just ignore it. So by nudging, 200 million families will get insured. When 200 million families get insured, we will become the world's largest health insurance market. We will become the world's largest healthcare market when the cost of everything in healthcare will come down dramatically. Now, how will the insurance help? Health insurance will help every aspect of healthcare. Surgery is the most unwanted stepchild of modern healthcare. Every government is talking about, developing countries' government, talking about malaria, TB and HIV, and they spend millions of dollars in treating them. Malaria, TB and HIV every year kills 3 million people. But lack of access to safe surgery kills 17 million people across the world. Now you must be thinking this must be one of those complex heart and brain operations. No, I'm talking about bellwether surgeries. Surgeries like cesarean section for obstructed delivery. Surgeries like the burst appendix surgery and surgery for compound fracture. These are basic surgeries which can be done, which is not available. Now, India with a population of 1.4 billion needs 70 million surgeries a year. Now, I want to ask you, do you know how many surgeries are done in India today? Only 20 million. We need to do nearly 4 times more surgeries than what we are doing. And this is what is required. And once the health insurance becomes popular, all these numbers will become a possibility. If the healthcare of the country has to be transformed, we need to wake up the sleeping giant. The sleeping giant is the government hospital, which has over 7.5 lakh beds. These government hospitals are located in the best location, they are most well equipped, they are very spacious, but the productivity is very poor. Now, if these hospitals can be converted like an academic institution for a postgraduate training program under the National Board of Examination, believe me, transformation will happen. Thanks to the Ministry of Health, now this transformation of government hospitals becoming a postgraduate institute is happening. Like why postgraduate institute will make a difference? The entire National Health Service of England is managed by postgraduate residents, mainly from India. I went to England not with the intention of treating a white man. I went there to learn cardiac surgery. In the process, 7 years I took care of all of them. And today, the younger doctors from India are going there for learning. Now, if only we can convert all our big government hospitals as a postgraduate institution, we will have amazing skilled doctor workforce. The other important thing what the policymakers have to do is to the Ministry of Health of every state must ask one data from every government hospital. That is, number of surgeries done in those hospitals. If you monitor the number of, if a hospital is doing large number of surgeries, that means their outpatient is very efficient. That means their blood bank is working. That means their lab is working, nurses are working. Because if these things are not there, they can't do the operation. So, and the other thing what the government has to do, Ayushman Bharat spends thousands of crore rupees. If the good number of Ayushman Bharat are diverted to government hospitals and Ayushman Bharat pays the money, if this money is given to the staff as an incentive for doing the operation, like some amount of money for the doctors, nurses, technicians, housekeeping staff, the money will come back to the government and this will transform the quality of care in a government hospital. The world's largest healthcare provider of the future will have no beds. It is going to be a software with few beds attached to it. The transformation what you have seen with Airbnb, then the Amazon and all these organizations where software is the main asset, same thing will happen in Indian healthcare and the global healthcare. The question is, everyone thinks this software will be developed by US. It is not going to be developed by US. This is the picture of US healthcare. You look at in US, the software called EMR, Electronic Medical Records, cost over $1 billion. It is very, very expensive. And these are built for the laptop and the desktop. They are not built on a mobile platform. Doctors look at the laptop and desktop 5 to 6 times in a day. They look at the mobile phone 200 times in a day. If you want the doctor to take care of the patient, develop the EMR for the mobile phone. So in US, as I said, their software doesn't work on the mobile device. But America is a very innovative country. They have put their desktop on a trolley with the wheels and they lug it around the hospital and they call it as a mobile platform, which is computer on wheels. So the large number of American hospitals communicate with a pager. You can see the doctor intensive care unit still using a pager. In India, if you want to see a pager, you have to go to a museum. So this is the advantage we have. I am convinced that the most modern electronic medical record, which understand how the doctors work, linking the doctor's patient's machine, will be developed in India. Because we are a country which is blessed with amazing software engineers. You just tell them one problem, they'll come up with 10 solutions. India is going to be the production house for the global doctors. It took 70 years to build 55,000 medical seats in our country. And our government, in the last 7 years, doubled the number of medical seats from 55,000 to 108,000. In just 7 years, we have doubled the number of undergraduation seats and the post-graduation seats. Now, for a country like India, when we produce doctors, we cannot think of what is the Indian requirement. India, when it manages the skilled workforce, we have to look at the global requirement, because an American doctor will never work in England. An English doctor will never work in America. But the Indian doctor is happy to work in any part of the world. And British Medical Journal published an article from Harvard which clearly mentioned that the American patients who were treated by Indian doctors lived longer than the American patients who are treated by American doctors. This is the brand which India has as healer of the world. Now, if we want to increase the number of doctors, there is only one country in the world which can just one government order can add 70,000 undergraduation seats to produce 70,000 additional doctors a year just by allotting 100 extra seats to existing 700 medical colleges. All they have to do is allow the medical college to take extra 100 students. Now, how this will work? Our medical colleges have an intake of 100 or 200, but they are occupying 20 acres of land with phenomenal infrastructure. If they get extra 100 seats, the preclinical work can be done in the existing place. For a clinical work, they can adopt a government hospital. And all this can be done with very little investment. Now, one question what the experts will ask is, where is the faculty? Existing hospitals, medical colleges don't have faculty. How are you going to get the faculty? All we have to do is to redefine what faculty is. I will, in a simple term, I will explain to you what is the current definition of faculty is. Let's look at faculty to teach cardiac surgery. Now, when you talk about cardiac surgery, generally about 3 or 4 names come to your mind. One is Dr. Naresh Trihan of Medanta. Other senior cardiac surgeon is Dr. Ramakant Panda from Bombay, who are operating on very influential, wealthy people, and people who were never operated by them also claim that they were operated by them. They are very popular. And also they name me as a surgeon who always operates on the poor people. We do one of the largest number of surgeries, and all 3 of us, according to the current guidelines of the Medical Council, cannot teach cardiac surgery because we have never worked in a medical college of India. So, if you are not allowing the top surgeons of the country to teach cardiac surgery, and that is a definition of faculty, there will be shortage of faculty. You change the definition, then you'll have enough faculty to run any number of medical colleges. So another important policy what the government has to look at is government should come up with an aggressive task of earning $100 billion of remittances every year from the healthcare workers. Now, we look at Satya Nadella from Microsoft, we look at Sundar Pichai of Google, and Arvind of IBM. We all think that they are the CEOs of these big American companies. Every American company CEOs are Indians. Why? They are brilliant people, no doubt, but the board of these companies made them as the CEOs not only because they are the brilliant people. The people in those companies who are building the product of the future, which will define the future of all these companies, are Indians, and board knows that the Indian knows how to get the best work out of the other Indians. That is the reason why they have become the CEOs. Believe me, the hospitals of the future across the world, the doctors, nurses, technicians, administrators, everyone will be from India. They have no choice. The reason is Indians are genetically designed by God as the healers. Who wants to work in a building where from morning till evening patients are only complaining, they are in pain? Indians are genetically made to work in those places. So it is a matter of time. We will be forced to manage hospitals outside the country. Now, for that to happen, we need to take one policy decision. That is, we should allow every 100-bed hospital to become a nursing college. If we allow 100-bed hospital to become nursing college, every year we'll be able to train few lakh young nurses. And these nurses, because they are working in a hospital, when they come out, they will be very skilled. You always hear the complaint that the nurses who are graduating, they have no skill. The reason is, if you look at a pilot training institution, at the age of 18, some boys and girls join a pilot training institution. At the end of 10 months, these students of a pilot training institution are given a license to fly a plane with passengers in it in 10 months. But a girl coming out of the nursing college at the end of 4 years, she may not be skilled even to check the blood pressure. What is the difference? The difference is If a nurse has to be trained, she has to be trained in a hospital. And most of the nursing schools are not part of the hospital. You cannot train a swimmer in a classroom. You want to train people to swim, they have to get into the water. Now, why we need to aim for $100 billion of remittance a year? This is because when these remittances coming from the nurses, doctors, technicians working in US, European hospitals, where does the money go? When a software company earns 100 billions of profit, that money goes to the shareholders. When $100 billion of remittances come to India, that money goes to millions of households, poor households in rural India, where the nurses come from, directly to their household, transforming their life. This is the power of remittance compared to the money earned by a company. This is the photograph of a young nurse who was trained by us in Bangalore. She joined us as a A&M, then a GNM she did, then BSc. When we started our hospital in Cayman Island, she joined the hospital as a nurse. There are over 100 nurses who are trained by us working in our hospital in Cayman Island, and they are sending home every month over 1 lakh rupees. And they are only in they're 23, 24-year-old. Tell me which profession in India, at the age of 23, 24, a girl from poor family can afford to earn and send home over 1 lakh rupees a month. There is only one profession, that is nursing profession. And this is what we have to accomplish. So I would like to end my talk saying that nothing is more powerful than the idea whose time has come. And I am a kid who was born in India soon after the independence. So as a kid, I was passionate about reading the newspaper. And there was always a news that any overseas delegate coming to India, the one statement they all used to make is, India is the country of future. And that used to make me very happy and proud. But I waited for 70 years for the country of future to announce its arrival. Thanks to Mr. Modi and his very passionate government, now I can hear the knock on the door. Few more steps, we will be there, and the world will never be the same again. Thank you.
Thank you very much, Dr. Shetty, for that deep dive into the intricacies of healthcare for the next decade. Ladies and gentlemen, we've got a jam-packed schedule for you now, as we have our guests who will join us before the Prime Minister's session. We have Mr. Harish Salve, the legal luminary, who will join us, followed by the Union Minister for...
One place takes the crown of the most prestigious address in Koramangala, Raheja Vivarya. One of the largest land parcels in Koramangala now becomes the canvas for its finest homes. You can call it the pinnacle of privilege in the city. A finely curated world with expansive private living spaces. Welcome to Raheja Vivarya.